Hi, I'm with Dr. Sangeeta, and she's all the way from New Delhi, India. We're in Rome at the third international conference for pancreatic cancer and liver diseases, and she did a wonderful job. In fact, she's a researcher there in New Delhi, researching vitamin D and cancer.
Right.
And vitamin D, if I was to ask you this question, what is the role of vitamin D in the prevention or reversing or treating of cancer? Maybe that's three questions.
Right. I'll answer from the backward.
Okay.
It says reversal. You said that.
Yeah.
So no, I wouldn't say reversal, but
Okay.
yes, probably helps in like prognosis. May help in slowing down the process of progression of pancreatic cancer, given
Particularly for metastasis?
No, not
metas-
from metastasis,
Okay.
but from stage-wise pancreatic cancer,
Okay.
given a right dosage of for the pancreas. Well, the papers and the literature till date suggest that a higher amount or
Which is
dosage
what?
which is right now they're recommending something around 200,000 units.
Okay.
So
Now I want you to hear that
Yeah,
number,
the
200,000
paper-
international units.
units.
Because most people aren't even getting
No.
close to that level
No,
of vitamin
the clinical
D.
trials that is right now going on, there are two people of thoughts who says that a very high dose to be given once a week, and others recommend multiple smaller doses given for at least say around 2 to 3 months.
Okay.
Duration of the
Yeah.
chemotherapy, especially because the
So
chemo,
so if someone is having chemotherapy, they do that in addition?
In
As a-
addition.
yeah,
In
addition to-
addition, because I don't think the practice is monitoring the vitamin D at all. Nobody does that. They look at all
But you
other
are.
parameters. We are starting to look
In
into
fact,
that.
you've got research studies
Right.
going on.
Going on in the direction.
right now.
Yeah.
So vitamin D at 200,000 IUs, and you're saying once a week, okay, dosage. What about someone who doesn't have cancer?
It's a normal. Oh, well, it depends on what type of diseases you have then in that case. Normally, if I go about saying a pregnant woman,
Okay.
she definitely needs a supplement that we all know about 60,000 units. It does recommend normally. But in addition, suppose you do have a genetic anomaly,
Okay.
then would giving this vitamin D be effective at all? Is a question. And I think there is major studies across the world also trying to find out the population that would respond and non-respond because of a genetic mutation, which is called SNPs, that is single nucleotide polymorphism. So that means you are a hereditary carrier of a certain polymorphism.
Okay.
And if it's homozygous, then all the more you would not be breaking down whatever dosage you give it to it, and it would have to come from another mechanism to give you that vitamin.
Okay, so your recommended dosage,
First,
how is this taken? Is it taken,
Orally.
so it's taken orally?
Orally.
When do you
Most-
recommend it by IV?
Well, that
Or is
should
that-
be-
is
that is kind of would be in preview of the surgical team who would evaluate
Okay.
under very specific condition, in serious conditions, lining up with ICU patients, and if they go, then that's the way. But normally IV is not the way mode of treatment.
Okay, so the best way to take it is orally and take large doses,
Large doses,
and
or
that's as a
you-
preventive
Right,
and
as a
also as a possible treatment
treatment.
for cancer, specifically in your research, pancreatic cancer.
Pancreatic cancer.
Okay, so that's great information, and you're seeing a correlation between deficiencies in vitamin D and cancer, is that
Right.
correct?
Exactly.
Okay.
But this data, as I said, it says that, in fact, they divide the Earth into two hemispheres, the northern and the southern. And the northern hemisphere is supposed to be more colder and sunlight less. And they say that in 2013 there was a large paper with multi-center studies which said that the prevalence and the incidence was much higher than the southern hemisphere. Now we in India and several countries like Africa and all are on the equatorial region. But you see Africa has a very high incidence, it's one of the highest.
In pancreatic cancer?
In pancreatic cancer.
But not so in the sunny regions?
Yes. Yeah, no, it is in the sunny region too. So it could be, as I said, it could be due to the mutational studies if you do them. Because that they cannot break down the sunlight, utilize them to make the vitamin D. And that could be the reason. And as Asia, that is China, India, Sri Lanka, even in fact in Australia, the Asia Oceania, we have much lesser incidence. Could be that it's either a heterozygous mutation or the vitamin D, probably the downstream component is provided by some other food or the way the physiology characteristics of that population.
So do you think pH plays a role in any of this?
I definitely think pH plays a major role in cancer because of the entire physiology changes continuously, right beginning from the neoplasm to the metastasis, and every stage is different. So the physiology would keep on changing and the pH would keep on changing. In this matter, we are actually, another of my project that's ongoing is on colorectal cancer.
Okay.
And we are not looking at the pH, but this is indirectly hinting at that, as we're looking at the microbiota changes that occurs during from the stage 1 to metastatic stage, and if at all the patients come back again with a recurrency. So the talk is about, so when you're talking about the microbiota, that's all over us. We're not simply talking about digestive microbiota. So here is that if this good and bad bacteria ratio changes, the pH changes. Okay, so even the food you are taking, it's all being broken down by several enzymes produced by this microbiome. And so if you are advocating, in fact everybody should be going into more of naturopathic kind of lifestyle,
more of a plant-based
So like now it's becoming more and more, even the Western population is moving towards the natural products, organic products that you call about so much about it, and other forms of it. And we would have to look into a few decades ahead to see if this practice has changed many disease conditions of ours. And I think it's ultimately the pH is being changed.
So pH is a factor,
yes,
and lifestyle and diet's a factor.
Yes, definitely. Lifestyle is a very big modifiable factor for any disease, not only cancer, but many of our keeping well-being.
That's beautiful. Thank you so much.
Thank you so much.
So much. Nice meeting you.
Thanks.